A 40 years old male is found to have multiple colonic polyp, and during the colonoscopy he mentions that he has extra teeth. What is the underlying diagnosis? So it is very obvious that it is colonic carcinoma. First of all, it is the colonic polyp, and second one, extra teeth. So colonic polyp with extra teeth. What is the diagnosis? Here are the options. Options are Gardner syndrome, Lynch syndrome, FAP, which is the familial adenomatous polyposis coli, neurofibromatosis type 1, and neurofibromatosis type 2. So what is the diagnosis? First of all, let's see the Gardner syndrome. The Gardner syndrome, it is a special variant of the familial adenomatous polyposis coli, and it is autosomal dominant condition. So FAP, Gardner syndrome, it is autosomal dominant familial colorectal polyposis, usually multiple colonic polyp present, and also the extra colonic disease, it includes the skull osteoma, thyroid cancer, epidermoid cyst present, and dermoid cyst, it is seen up to 15% of the case. And what is the behind the pathology? It is due to mutation of the epicensis gene, which is located at chromosome number 5. So chromosome number 5 epicensis gene mutation, and Gardner syndrome develop. Due to colonic polyp, most patients will undergo colectomy to reduce the risk of the colorectal cancer. And now consider it is a special variant of the FAP. So it is not FAP, it is a variant of the FAP. So Gardner syndrome, it is a autosomal dominant condition. It occurs due to mutation of the chromosome number 5 epicensis gene, and it is a special variant of the FAP, which is the familial adenomatous polyposis coli. And for reduction of the colorectal cancer, pancolectomy usually done. So what are the Gardner syndrome associations? Here we can see the Gardner syndrome, it is an autosomal dominant condition, and it is the colonic polyp, that means the multiple colonic polyp with supernumerary teeth, jaw osteomas, congenital hypertrophy of the retinal pigment epithelium, osteomas of the skull, thyroid cancer, epidermoid cyst, fibromas, and CBCS cyst present. That means in case of the Gardner syndrome, there are the huge extracolonic manifestations. And here we can see this is the normal teeth, but in case of the Gardner cyst, there is the extra teeth. Here we can see the floor of the mouth, there the huge number of the teeth, and this number of the teeth may be sometimes less, sometimes more. And also here we can see this is the epidermoid cyst. Here we can see the epidermoid cyst, lipoma, fibroma also present. So here we can see the different type of the extracolonic manifestations, such as supernumerary teeth, jaw osteoma, congenital hypertrophy of retinal pigmented epithelium, osteomas of the skull, thyroid cancer, epidermoid cyst, fibroma, and CBCS cyst. So it is the huge extracolonic manifestation. So what is it? It is the Gardner syndrome, and here we can see in Gardner syndrome there is the extracolonic important manifestation with there is the colonic polyp or colonic cancer. And in case of the Lynch syndrome, what is Lynch syndrome? In case of Lynch syndrome, it is the right-sided colonic polyp or colonic cancer with this mucinous type, and in case of the FAP, there is more than 100 polyp, but in this condition there is no extra teeth. In case of the FAP, there is also some extracolonic manifestations, such as the duodenal adenoma, gastric carcinoma may be present, but in jaw and extra teeth usually not present in case of the FAP. On the other hand, the neurofibromatosis 1, neurofibromatosis 2, they are not the feature of extra teeth, because the neurofibromatosis on neurofibromatosis type 2, they have the multiple neuroma all over the body, but there is no extra teeth.